Live. We are live. Welcome to our VETgirl YouTube live event. Very excited to be here with Dr. Tinsley. We're going to be talking about you are what you eat and some allergic skin management. But welcome, whether it's noon Eastern where you are. I know Justine is 11 a.m. Central. I know we have people from all over the world that are going to be logging on. So whether you're having breakfast, lunch, dinner, or maybe a midnight snack, who knows? Welcome to our VETgirl YouTube live event. My name is Garrett Pachtinger. I'm the co-founder of VETgirl and a board-certified critical care specialist. I am based out of that as I look out my window, kind of cloudy and drizzy, the Philadelphia area right now. Justine, what about you?
Hi, everyone. I'm Justine Lee. I am a criticalist and also a co-founder of VETgirl. And thank you so much. It's so cool to see people from all over Ireland, Chile, Portugal. I'm based out of St. Paul, Minnesota, and it's about 55 degrees on a cloudy day.
And Dr. Tinsley, what about you?
Hi, I'm out of Louisville, Kentucky, and it is a very bright sunny day. We got the sun trying to blind me a little bit, but we're here.
We see that coming in your eyes. And so, well, welcome. And you know, you are the star of the show. Thank you for being here. And if this is your first VETgirl YouTube live, you know the drill. If it's not, you also know the drill. Listen, please type in where you are logging from around the country or around the world. Like Justine said, we already have people from Ireland, Chile, Arkansas, Arizona, Pennsylvania, Portugal, the Pacific Northwest. So please typing in. We love seeing where you're logging in from and continue to do that as I go through some of our VETgirl housekeeping. But welcome to our event today. As many of you know, when we have the pleasure, the fortune of having an amazing educational partner, we are honored to provide completely free race-approved continuing education. So thank you to Purina, ProPlan, Veterinary Diets for being here with us today and allowing Dr. Tinsley to be with us today and giving this awesome, awesome lecture. So thank you to Purina, ProPlan, and all that they do for the veterinary profession. If this is your first VETgirl YouTube Live, this is how you get your CE certificate. We're going to leave this form open until 1 p.m. Eastern, this is a 12 to 12:30 Eastern, so half an hour after the session. But within that hour time as we start now, you have two ways to register to get your CE certificate. The first is you can use your fancy smartphone and look at that QR code, click on the link that comes up, and fill out that form. Please remember when you fill out the form to use the email address associated with your VETgirl account. That's how we know to match up your CE certificate with your VETgirl account, so it will be found in your My Credits page. If you don't have a fancy smartphone, that's cool. No worries. I love my old flip phone also. In your browser, type in it whenever you want up till 1 p.m. Eastern, tinyurl.com/VG for VETgirl. So VG and then today's date, 04/18/24. Justine has also put another link into the YouTube chat. So again, please go ahead and fill that out by 1 p.m. Eastern time, which is about 57 minutes from now. And again, please to make sure you use your VETgirl associated email address so your CE certificate will then get into your My Credits account directly. Should be there probably by 2 or 3 p.m. Eastern today after we verify. Also, YouTube, I know sometimes depending on your device, it can be a smaller window. Look at that bottom right corner, that kind of open box. If you click on that, that will make the YouTube video a full screen and a better viewing experience for you. We hope if you are a VETgirl member, you are taking advantage of this. If you're not a VETgirl member, you should think about it. We have amazing content. We provide clinically relevant, practical, cutting-edge, and unbiased education in a multimedia approach. So whether it's a YouTube live event like this, an evening webinar, a podcast, a blog, a newsletter, an e-magazine, check out our site. We think you will love it. We know you will love it. And also part of your VETgirl membership, we have certificate programs now, which is a group of carefully curated content to help you become more proficient in an area of your choice. So whether you want to get more proficient in anesthesia and analgesia, ER medicine, ophthalmology, and we typically put out at least 2 certificates every year, certificate programs every year. We definitely think you love our certificates. Many of our members absolutely love them, and we hope you do too. A normal membership, it's really cost effective. An individual veterinarian, $269 per calendar year. If you signed up today, April 18th, 2024, you're good to the 18th of 2025. We also have cost effective team memberships. So we know many have said, I love my membership. And for a discounted price, I want to enroll many members in my hospital. Check that out. And we hope you've already done this because we are sold out except for our Neuro Masterclass. We still have a couple of seats left, but we're super excited to be in New Orleans in just a couple of months. Beignets, chicory coffee, marching bands, trumpets, and a whole lot of fun. So if you are going to be there, drop us a note in the chat and let us know. We're excited to see you there in a few months for a great VETgirl you. All right. With that said, I know you love us, Justine, myself, but you're not here to listen to us today. Dr. Tinsley, again, thank you so much for being here. We know you're in Louisville, Kentucky, but what do you love about what you do, your practice? Tell us a little bit about yourself, and then please take it away. The floor is yours.
All right. Thank you so much. And thanks for having me, VETgirl. This is always fun to speak to people, especially internationally. So like you said, I'm out of Louisville, Kentucky. My journey really quickly, I did a rotating small animal internship right out of school in 2017, spent a year in general practice after that, did 1 year of a derm internship specifically, and then finished my residency last year. I love about derm, there's so many things, but I would say I love the feel of having some long-term clients with general practice and being able to walk them through really chronic diseases, whether it be allergy, autoimmune, some forms of skin cancer. I'm obsessed with it, and I feel like we don't get enough of it in school. So that's what I really love about my profession. So looking at our outline today, we're going to be talking a little bit about cutaneous adverse food reactions, whether it be hydrolyzed novel proteins, which we're familiar with, and a newer, much newer category. We're going to go into some good detail about elemental diets. And atopic dermatitis and skin barrier management we'll get into a little bit towards the end, but how does nutrition form a role when we're working with these allergic patients, and how do we fold it into multimodal therapy to get them better? So let's talk about the basics. What is allergy? When I'm talking to an owner in general, I like to describe it as itching, licking, and scratching, all these forms of pruritus that are occurring on otherwise pretty unremarkable, grossly to the eye, fairly normal looking skin when things first start out. And then they have pruritus, they self-mutilate themselves, that leads to lesions and infections that we see in clinic. And essentially it's the immune system overreacting to pretty much these three big things that are causing itch, and sometimes otitis being something flea related, something food related, or something environmental for the most part. So this is my own dog, and he doesn't have a job, so we're just going to exploit him for a lecture. His name is Renly. He's a 9-year-old neutered male mixed breed dog. He has a history of non-seasonal pruritus that's focused primarily at the paws and his inguinal area. The pruritus for him always started before his lesions occurred, which is important. And he's had a couple of episodes of otitis 1 to 2 times in his life. The only medications he was on at the time that I was doing this workup was just NexGard once a month. He had no significant relief from past trials with antipyretics such as oclacitinib or lokivetmab, so he wasn't one of the lucky ones. On physical exam, he had some pretty classic lesions. So in his inguinal area, you can see he had a lot of erythema. He had some hyperpigmentation in the area, in that same area as well. Not pictured are his paws, which had some interdigital erythema on all of his paws and a pretty unremarkable otic exam. When I want to break down a case like this, I kind of think of it as a full picture. So what are my differentials? I want to see if there's a secondary infection, whether that be bacterial or yeast in origin. I do always think, does this case also have some sort of mite going on, like scabies or Demodex? Probably would be a confounding or concurrent factor, so wouldn't be triggering this particular case based on the history, but would be something to keep in my mind. And Demodex, they love the paws. They love patients who have interdigital erythema and can help cause that. So that's something in my mind, even though it is technically on an isoxazoline with that NexGard, I never completely take it off my list because sometimes people skip medications or forget. Sometimes they get the wrong size or they get it online. With flea allergy dermatitis, this particular case, it doesn't have hind limb alopecia that would make me think, gosh, this is really seriously a flea allergic dermatitis patient, but it's something that's in the back of my mind. And sometimes flea allergy cases only present with lesions on the belly. The other that are a little bit more likely would be something like cutaneous adverse food reaction or food allergy. And of course, atopy, right? Atopic dermatitis, environmental allergy is by far the most common on this entire list. So let's look at his diagnostics. We started off with a skin cytology. He had 60 to 80 yeasts per high power field. So literally he has a yeast party going on. His skin scrapes. So I did go ahead and scrape him superficial and deep. Didn't see anything exciting there. I went ahead and started him on a 8-week diet trial with Purina HA. I prefer the vegetarian formula for mine. And I treated him, we started him on ketoconazole for his malassezia. So you can see in this picture, it is covered in yeast, most of them aggregating on a few skin cells, but we see our little snowmen or footprints, however you like to characterize them. This is about 100 times power per oil immersion field. And his itch level was pretty stable. So at this time, I didn't start him on any additional antipyretic medications. And there's our little party. So cutaneous adverse food reaction, literally food allergies that affect the skin. Let's get into it. The classic and the thing that we learn in school, elimination diet trials, are still going to be the gold standard for diagnosing adverse food reactions in dogs. My general rules of thumb are going to be still using a prescription diet trial for a minimum of 8 weeks. You can go up to 12. That's also great. Better if you can get that far with them. You must re-challenge the old food after you choose your period. So I'm going to feed a specific diet that's prescription for 8 weeks. After that, I'm going to slowly feed back the old food for about 14 days. And most patients with food allergy are still going to flare in that 14-day period. But that is a requirement to help us tell the difference between, is there seasonality? Did we get benefit just because we started this diet trial at the end of fall and we got into winter? So it's really the only way to confirm that a patient does have food allergy, which is by giving back some of the old food. And I also want to point out, it's really important not to use over-the-counter diets for these cases. So this is a study called Determination of Mammalian DNA in Commercial Canine Diets with Uncommon and Limited Ingredients. It's out of 2018, published in Veterinary Medicine and Science. Essentially, they looked at 21 over-the-counter limited ingredient or single protein diets that were PCR tested, and they looked for and found DNA from one or more species that were not declared on the label of those diets in all 21 of the diets that they looked at. Therefore, this indicates that there is a lot more cross-contamination of proteins in over-the-counter diets than we realize, so we can't always trust exactly what's on the label. So because of studies like this, most dermatologists are going to prefer a prescription novel protein diet over an over-the-counter one, because most of those diets are going to come from companies that specifically test for cross-contamination of proteins. And I'm trying to change the main protein in most of these diets. So that's really important. And I'm not aware of a specific study that looks at, or if there are even any over-the-counter hydrolyzed diets. So most that you're going to find are going to be prescription in the hydrolyzed category. So when you kind of look at all of the data together, it's always best to just go with a prescription diet, as most of those companies are going to be checking for cross-contamination of proteins when they are creating these diets. And then last note here is a good reminder that serum food allergy testing, it's still not good. It's still not helpful specifically for food allergies. So we really do have to do the diet trial if we want to get accurate results. So let's look at the general categories for elimination diet trial. Again, we're kind of familiar with novel protein diets where we're choosing a new protein and ideally a new carbohydrate source. And we're using them hopefully to avoid the immune system's overreaction, leading to itchiness, sometimes GI problems. And a quick note here is to remember that proteins are closely related. And when we're using proteins that are closely related, for example, like chicken, I'm not going to use a duck diet for a patient who's been eating chicken all of his life and considering it a novel protein. So it's really best to switch to something very different. So for chicken, if I have a chicken eater, duck would be bad. I'm going to eliminate all poultry because you can have cross reactions of proteins with similar species. I would prefer to use something like maybe rabbit or kangaroo, and I'll kind of mention those again later. When I'm looking at patients who are going to be good for a hydrolyzed protein diet, so hydrolyzed essentially means, in the easiest terms, we're taking large proteins, making them smaller, and we're using that in order to reduce the likelihood of the immune system seeing this large protein molecule and overreacting, leading to food allergic flare, itchiness, and redness on the skin. But they're not perfect. So some studies have shown that there are a percentage of patients fed hydrolyzed diets that may still trigger the immune system because it can be difficult for every single protein in the food to avoid the immune system and get them small enough. And then the last category I'll list here, I'll go into more detail on the next slide, but elemental diets are a whole new category. But keep in mind that little note about proteins needing to be small to avoid the immune system. So that's going to come back. So what is an elemental diet? They're essentially derived directly from amino acids. These diets, again, they're not hydrolyzed, but they take these purified synthetic amino acids and put them directly into the diet. So a nutritionist once described this to me as, we're taking literal amino acids that you could essentially buy at like a GNC or a nutrition store. We're making them extremely pure and directly adding them to the diet. So the body can skip a step. They don't have to digest down these proteins because they are literally being delivered as the building blocks of proteins. So, for example, if the goal of a prescription hydrolyzed diet would be to, again, reduce the size of the proteins I'm delivering to, let's say, less than 10 kilodaltons, a very tiny molecule, the size of an amino acid is 0.075 to 0.2 kilodaltons. So they're extremely smaller. And therefore, an amino acid-based elemental diet is going to deliver molecules many, many times smaller than any other diet, and therefore would be less likely to trigger the immune system. And since elemental diets are directly putting amino acids into the diet, they represent a completely unique and separate category from our traditional categories of hydrolyzed diets or even the novel protein diets, because it's not literally adding proteins into the diet, it's delivering them in an indirect way. So you get to have the amino acids that the body should use anyway. By giving them directly into the diet, they're extremely digestible. So the body has an easier time with these diets. And there's less of a chance that you're going to have them delivered as proteins because they are completely different. So this is my baby. It is one of the very few studies on elemental diets. It's called an open label clinical trial to evaluate the efficacy of an elemental diet for the diagnosis of adverse food reactions in dogs. This article was literally my research project when I was in residency, which Purina was gracious enough to sponsor. It was published in 2023 at a Veterinary Derm. It was a multi-study or multi-hospital pilot study to determine if the new Purina elemental diet, which they came out with called EL, was efficacious for diagnosing cutaneous food allergies via diet trials in a clinical setting. We did determine that it could indeed diagnose food allergy. The elemental diet is complete and balanced. I believe it also does support puppy growth. 18 out of the 45 dogs that were diagnosed with cutaneous adverse food reaction, or 40%, out of the 45 dogs that completed the diet, 18 of them were diagnosed with cutaneous adverse food reaction. So that's about 40% of those patients, which is a pretty big number, as other studies have quoted closer to 20% on the prevalence of food allergy in their populations. So myself and the other clinicians who did this project were really, really surprised by those results. We also noted that the smallest volume that induced a food allergic flare was as small as 1 teaspoon. And this is interesting because we don't have a clear indication in veterinary medicine of the exact volume of an offending diet that can trigger a flare. So this is information saying, hey, as small as a teaspoon could cause a flare. And in our study, we fed back the 1 teaspoon on the very first day of the patient being fed back the old diet as a part of their diet challenge. So our study proved that, again, 1 teaspoon is small enough to cause flare. In our specific study, we saw 2 dogs that flared on that first day of their diet challenge, and there was another dog that actually that flared on the second day to 1 tablespoon. So it's more conversation and starting the conversation regarding, hey, really small amounts can cause flares. It's important to keep that in mind, especially when people are thinking, well, how strict do I have to be on a diet trial? And the answer is pretty strict. We also found that this diet is very palatable, so it's a really good one to choose. And I believe that the diet is temporarily off of the market as of last year, related to some things that you can contact your local Purina rep, since I have a good relationship with Purina, but I don't actually work for them. But my understanding is that there's some supply chain issues and other things going on that they've now resolved. But again, it's supposed to be coming back this year, so talk to your local Purina rep about that. But it is an excellent diet for diagnosing food allergy. So let's get back to Renly. So here's his update. He did not flare on his diet trial and diet challenge. So we fed him for 8 weeks the Purina HA vegetarian formula, which the elemental diet was not out, so I couldn't use it on him at that time. But he didn't flare. He didn't improve much with his food trial. And then after the 8 weeks, we fed back the old diet for 2 weeks, still no flare. So he was diagnosed with atopy. His malassezia improved with his ketoconazole. And at that time, we went ahead and switched him to an atopic diet specifically. So DRM is Purina's version of an atopy diet, which we'll get more into in just a second. After being on that diet for 2 to 3 months, he started to slowly improve further. And I also went ahead and did environmental allergy testing via direct skin testing or intradermal testing. And I also did serum allergy testing. So serum allergy testing for environmental is okay. I wouldn't do it for food, but you can use those results to help formulate immunotherapy. I usually describe immunotherapy as a serum based off of, number one, the patient's history, when they flared throughout the year, correlating it with the results that we find from that skin test, and then making them their own serum, their own personalized vaccine, which by far and large is mostly pollens mixed with sterile water. You give that at home over time. So Renly was on his subcutaneous immunotherapy, or SCIT, for approximately 1.5 years, and he started seeing some improvement with the combination of the atopic diet with his immunotherapy, and overall he's doing much better. So this is a good time where I like to kind of remind people again about environmental allergy testing. Technically, by the book, it is not considered a diagnostic test. So allergy testing should really only be done once you, the clinician, have clinically ruled out any other cause of itchiness, ruled out all the other allergies. So this is a clinically atopic patient. Because there are false positives and false negatives with the testing, it's not helpful to do that at the beginning of a workup. So we really want to save it after we have confirmed atopy based on our clinical suspicion. Then we allergy test, and we only allergy test to start them on immunotherapy. And immunotherapy can also take up to a year to begin working. So it's really something that's an important part of my allergic workup, but it's going to be after I've diagnosed them with atopy. And Renly still has some occasional minor flares, so nothing is perfect, but this is a great case for recognizing a lot of these patients are hard and require more than one form of therapy to get comfortable. So let's talk a little bit of detail about atopic dermatitis. So when I think about nutrition with it in particular, reminder, as we've already mentioned, atopy is a diagnosis of exclusion. The best time to consider an atopic diet is after I've done an elimination diet trial. I've completely ruled out food allergy for this patient. They did not flare on their diet challenge. that's the best time when I'm going to usually reach for an atopic diet, is when I've clinically diagnosed them with atopy. Most of these diets work by adding something back to the skin barrier. For the most part, that's going to be fatty acids. And it's important to remember that when I'm using a supplement like that, they can take a couple of months to start providing relief. So for the most part, it's going to be a little bit similar to a diet trial, right? I may still need 2 or 3 months on an environmental allergy diet or prescription atopic diet to make my patient better. And usually food's not going to be the end all be all. So keep in mind that they still may need other therapies to be comfortable. So some takeaways: only use prescription diets for elimination diet trials. It is not helpful to use over-the-counter diets because they may have undisclosed proteins that are not on the label. My personal favorites, when Elemental comes back, I usually choose that one. For hydrolyzed diets, Purina HA Veggie, Royal Canin HP, and Ultimina are my go-tos. Some novel protein diets. So Rain Nutrition is I think a lesser known brand, but a good one. They do have prescription diets for rabbit, kangaroo, or crocodile. How I typically decide what's my patient going to use, I don't have a specific preference over hydrolyzed versus novel protein. I usually base it off of the history and a conversation with the owner. If I have no history or it's a rescue and we don't know what that patient has been eating before, I usually lean towards something like hydrolyzed. If they want more treat-based, I find that companies like Rain Nutrition, they have a lot of treat options available. And if you know that that patient, let's say they've had the puppies or cat since the very beginning of time when they were born or pretty close to that, they know everything it's eaten, then I might reach for something that's more novel protein. And usually there's more options for treats. And then also keep in mind, novel protein diets, we're ideally trying to change to a new protein and new carb the patient's never had before. And again, atopic diets are best used after a diet trial, and they can take time. So it still may take 2 to 3 months before we see improvement there. Here's my references. And just wanted to thank again Purina and VETgirl for having me on this quick talk. You want to find me, Instagram or TikTok is a great way to look. My tag is Derm Dr. Jeff, spelt with a G in doctor. And I also have a podcast you can go check out. We talk about veterinary life in and out of the clinic at the Dr. Bros, also spelt with a G.
All right. Dr. Tinsley, that was awesome information. I know Justine is going to take over in just a minute to get some of your questions, so please go ahead. And if you have any questions, type them into that YouTube little comment question screener. But I did want to remind everybody one more time before we get to questions, please, this will be open for about another half an hour. In order to get your CE certificate, you need to fill out a form for us that you were, yes, here in live attendance. So whether you use your fancy smartphone and that QR code on the screen or type into your browser, tinyurl.com/VG for VETgirl, VG, and then today's date 04/18/24. Please do that within the next half an hour by 1 p.m. Eastern, and then typically by about 2 to 3 p.m. Eastern, we verify attendance, and your CE certificate will be linked to your VETgirl account in your My Credits page, which is, again, the reminder to please, when you fill out that form, use the email address associated with your VETgirl account. Justine, I'll pass it to you for some questions.
Awesome. Jeff, thank you so much. That was amazing. Having had to do a food trial on my own pit bull when he was a puppy or a pretty young dog, I remember getting dramatically yelled at by an Australian dermatologist. We were sitting at a conference and I was like, yeah, my dog's in a food trial. And he's like, well, is he better? I was like, meh. And he's like, with food trials, it should be like, oh my God, he's so amazing. And I was like, well, the milk bones that the mailman like drops through the mail slot probably don't help. And he was just like, oh. But in all this stuff, everyone knows I'm a derm idiot. Okay. So that's why I went into ECC. All right. Awesome talk. All right. A couple of questions. And again, just thank you so much for reiterating the importance of veterinary prescription diets when it comes to food trials. One question, a veterinary dermatologist mentioned that crocodile could cross-react with chicken. So if there's any diets with crocodile, do you avoid that, or how do you handle that scenario?
Yeah, that's an excellent question. I know the exact study they're talking about, which mentioned that there could be some DNA cross reactivity with proteins. It was really interesting, a very long study, but essentially it did make some, I guess, theorization as to could chicken potentially cross-react with crocodile. I think it was based on just one single study. It was a good study. You could consider specifically avoiding crocodile for poultry-based for patients who have had poultry in their diets. I don't necessarily avoid it yet, but it wouldn't hurt anything. If you did, I would understand, and there is research to support it, but just a little bit.
So crocodiles and chickens are like distant cousins. Is that what we're saying here?
It's so strange. It's like in the phylogeny, and like I don't know the connection, but I'm not super strict about that personally. But I guess you could. It's fine.
I will say, for our conference in New Orleans, people oftentimes will order, like, you can get alligator there, right? Like alligator, deep fried alligator, and it does actually taste like chicken. Who knows?
I agree.
Right. Another question. How does Purina's Elementals diet compare to an allergenic Royal Canin, which is Ultimino in the United States? And how low is the protein KDA size?
So the protein kilodalton size is about 0.07 to 0.2 kilodaltons in general. That's the size of general amino acids. And so diets like Ultimino are trying to get the proteins down to less than 10 kilodaltons. So the difference is when you have Elemental, from the jump, all of the protein sources are specifically amino acids. So they're not taking big proteins and making them small, whereas Ultimino is taking big proteins and making them small via hydrolyzation. So Elemental is not hydrolyzed. It's only amino acids directly being put in. They were never large proteins.
Wonderful. Thank you. What's the best way, and this was true for me too, what's the best way to convince an owner to pursue a dietary trial? Because as we all know, compliance can be poor, especially if there's multiple people in the household who like to sneak treats. And I get it. I remember the internets I used to work at yelling at me. He's like, pets don't need treats. I was like, pets need treats.
No, I love that question, because food is love, and that's how we love our pets.
Right.
So it comes down to having a conversation with the client and asking them, can they do a diet trial right now? So I lay out the rules. Can you be strict on this diet for a minimum of 8 weeks? If you need treats, they have to be extremely specific. I usually tell owners, I want to control everything that goes into their mouth. That applies to everybody at home. So there are some families where they say, nope, that's not going to work for now. I got young kids. They're going to feed them. Grandparents, they're going to feed them no matter what I do. Then hold off and say, okay, if we can't be strict and do it right, let's just put it in the record, do it later, treat their symptoms, get them comfortable. We never negate our ability to do a diet trial in the future. And then if they can do one, they know the ground rules. They should tell everybody at home. I like to send out handouts and say, give this to the dog sitter, give it to grandma, give it to any visitors. Everybody needs to know they're on a diet trial. So for me, I try to be all in or all out, because there's going to be natural mistakes.
That's such a great question and a great answer. I was going to say, I think my 5-year-old drops more food on the floor than he actually gets in his mouth. And so if he said to me that my dog needs a diet trial right now, I would certainly have a hard time. And I think that's a great point about working with the owners and making sure that what we recommend, sometimes it's compliance just because they're not doing their job, and sometimes they're doing their best, and we can't judge them for that. Sometimes it takes me having to put myself into their shoes to say, oh God, I couldn't do that either. Let's find an alternative until, like you said, Dr. Tinsley, until we can find the right time to do it the right way.
Yeah. And it's okay.
Yeah.
Love it. All right. Even though you're feeding an Atopic diet or like a derm diet, can you still give over-the-counter treats?
Yeah, that's a good question. So I'm less strict about those, because at that point we've ruled out food. So there is a chance, probably if you ask the nutritionist, they would say, don't give anything if you really want to see if only the diet is working. But I do find that at the point I'm giving a derm Atopic diet specifically, they probably are already back on some sort of multimodal therapy or anti-itch medication. So I don't mind treats for derm specific diets if we're at the Atopic point.
Great. I have seen on some veterinary social media posts how you can make some of these elemental diets or these hypoallergenic diets into treats with the canned food. But I have been warned that it really stinks up your house.
I bet it does.
All right. One question actually about your own dog.
Yes.
Did you start ketoconazole topically or systemically? And do you have a preference for ketoconazole or itraconazole?
Yeah, I started ketoconazole orally at 5 mg per kg once a day. I did 30 days on him. And you certainly could have gone topical, but I am one of those owners where just topical just isn't going to happen for me. I have proven to not be compliant, even bringing home products. So I go oral, and my preference is for ketoconazole over itraconazole in this particular case because it's just cheaper. So itraconazole or itrafungal, definitely name brand, it's going to be quite expensive and sometimes has more side effects, but it is typically considered the gold standard. So nothing wrong with it. It's just in my area, it's a little bit more expensive.
Awesome. Awesome information. We love these little 30-minute clinical vignettes for people to wolf down food and learn at the same time. Please remember to fill out your CE with the email associated with your VETgirl account, whether or not it's an elite account or a free trial account, in order to get your CE, like Garrett mentioned before. Dr. Tinsley, huge shout out to you. Awesome. Relevant CE. Always love any derm help I can get. And for all those attending, remember to fill out that form, type in any comments to both Dr. Tinsley and also to Purina ProPlan Veterinary Diets. We'll make sure to pass that on to them. And again, thank you for taking the time to learn. I know you guys are crazy busy. Who gets a lunch break or a coffee break or wherever you are? So we always appreciate you guys learning with us. And again, just a huge shout out to all of you guys for what you're doing and being on the ground floor or whatever the saying is, doing all the work. So we really appreciate it because we know you see a lot of derm cases. Thank you, everyone.
Thank you.
Hopefully see you in New Orleans. Have a great day, everyone.